Hey, I'm Dr. Brian Brown with Chiropractic, and I'm here to talk about a disc and one of the common issues that plague a lot of people, which is a disc herniation. So first, let's talk about what is a disc, okay? So I have my plastic spine here. So a couple of structures of the spine I want to explain so you can understand it a lot better. You have the bone, which are called vertebra. You have these pads that you see represented here. These are our discs here, okay? And then you have your spinal nerves, which is yellow, which exit right, and a little hole right behind the disc here between the two vertebrae there. Now, the function of the disc are for shock absorption. So they're the shock absorbers between the bone. So when you have when you jump or anything like that, the pressure doesn't supposed to go into the bone. It's supposed to go into those discs, okay? They're made up of more like cartilage. And there's an example here. This is a top view of a disc here. And if you look really closely, right in the middle, it's a different color there. That's more of a gel type material. It's very protein based, very liquidy. It's there to hydrate the bone and also the spine. And the cartilage around is a lot firmer, and it's there to kind of hold in that gelatin. And it acts as kind of a ligament so you can move around, okay? So one of the common injuries that plague a lot of people, and it's not just traumatic injuries, it can be degeneration over time, and it's disc bulges and disc herniations, okay? So what does that mean? I want you to think about a balloon. I want you to imagine the disc is a balloon, and I'm gonna put both hands, which represent the bone, the vertebra, on top of that balloon. As I push down, of course that balloon is going to start expanding wider and wider, okay? So that's what's considered a disc bulge. Don't think it's a death wish or anything like that because you have disc herniations. Most people have them, especially those bulges. And the main culprit is gravity. Gravity is something that weighs down on us over time, and our own weight, it adds extra pressure to those bones, and it starts to cause pressure to those discs, and it starts to bulge out, okay? You can have pain from disc bulges, or it can be asymptomatic. You don't have to have any pain from it. But sometimes with injuries or repetitive motions, it can pretty much turn that light on or create that pain, and you start to feel symptoms from those disc herniations or disc bulges. Now, a herniation is a different animal altogether. Usually a herniation, I like to use the example of a jelly donut. So I'm gonna use my hand as the vertebra again, and just imagine I have a jelly donut. Well, that'll be a huge jelly donut, but a jelly donut here, and I just squeeze real hard, okay? That's the impact that happens to the spine with like car accidents, sports like football and soccer and things like that, that have those very traumatic impacts and those sudden impacts. And as I squeeze that jelly donut, usually it's going to explode out in one direction, okay? So when we're looking at our spine here, that one direction that's the most common where it explodes out is right on the side, kind of back and side, okay? This is the front here, right in this area right here. So as you can see, the nerve comes out at the area right there, and that's where you have that nerve compression that happens from disc herniations. Depending on the size of the herniation will depend on if you have pain and sometimes how severe the pain is, okay? And that will change as far as how your treatment will go as well, okay? So the second worst common type of disc herniation is when it pushes straight back, okay? The back of the disc is right there, and you can see this yellow part right here, which is the spinal cord, and they can push right against that spinal cord and also cause symptoms, okay? And depending on how big the herniation is, it will tell how your treatment will go. Now, treatments, like I said, most of the time you don't feel the pain from the disc herniations. When you have them, it causes inflammation and swelling in that area. So some people like to go the prescription route, and they get like anti-inflammatories or over-the-counter anti-inflammatories, and sometimes, not sometimes, but I know chiropractic can also help. I have helped a lot of people with that have disc herniations, and first you have to make sure it's safe to treat that disc, okay? Because sometimes it's so bad that we don't want to push into that area. But chiropractic adjustment would definitely help to relieve that tension off of those nerves and help take the pressure off of that disc. It can get as bad as surgery. I know some people that have had surgeries from disc herniations because their pressure on that nerve on that spinal cord is that bad that they have to go in and take out areas of the spine to help take the pressure off of those structures that cause that discomfort. But those are the two most common types of disc herniation. Like I said, most people have them. Don't panic when a doctor says that you have a disc herniation. Just make sure you listen to the doctor, get the right information, read up on it, learn about it, learn all of the different treatment options. My first option, of course, going to a chiropractor because we fix everything naturally, okay? And most of the time it's a structural problem that's causing you to be susceptible to these disc herniations in the first place, okay? So getting your spine in right alignment will allow the pressure on those discs to be evenly, and it'll decrease the risk of you having a bulge or that abnormal pressure on your disc in the first place, okay? So figure out what you want to do, come up with the right treatment plan, and get the treatment that you need. And if you have any questions, you can always email me or email the office. All of the information is on the website. If you want any other information about disc herniations, if you have one, or if you know someone that is suffering from one, okay? So you can always call us, go online, courtchiropractic.net. I'll see you next time. All right, have a good one.